in Congress on the same panel one day, and clearly we have a lot to do on records activities together, and we're going to do that in the spirit of collaboration and cooperation, and I'm excited to have him host us. In addition to Julia from MacArthur, I also want to give some love to George Strawn from NITRD, the program that coordinates our networking and information technology R&D activities on behalf of the President, and thank them for their participation in this endeavor. I have three basic objectives. One, remind us where we started. Two, frame the methodologies we've used in the tech community to think about the power of open government as it translates to achieving the mission objectives of our President. And three, perhaps most importantly, for those who've seen this riff before, new material, around the 5 key questions I'd like to pose to this group over the next day and a half. So with that, let me get started with history. As many of you know, that's my cue to get to the next slide since I've got there. Thank you very much. This was our first homework assignment. It actually predated the President's first full day in office because Beth Novick, who had served as my queen bee on this issue, our deputy for open government, who had engaged on these issues on the campaign first, and then very aggressively as our lead in the transition team, to harness recommendations from all of you to make real the President's commitment to these principles. And then, obviously, the President's first full day in office leading to the Open Government Memorandum, which has been the bedrock, if you will, to our initiative. And I love to showcase healthcare.gov as an example of the power of information. Here we have the President's signature initiative in healthcare, and one of the first deliverables called for in Congress, not the last, but the first, was to actually inventory all public and private insurance options for every American today. So shocking to me that that database did not exist. So as a valuable contribution to the overall health insurance marketplace, the President called on the private sector and our public sector partners at really no, there was a little bit of rulemaking in the sense that the bill called for a database of this sort to be created, but there was no penalty for non-compliance, there was no rulemaking that had to happen, there was no big budget associated with this. It was literally a question, will you share that data? And the industry, to their credit, responded overwhelmingly. Nearly every major health insurance option in the country is now accessible on healthcare.gov. What was even more interesting than the database was the features that the President introduced because they speak to the principles of what we expect to come out of our open government activities. Number one, to create greater transparency, we said, how about we organize pricing data into this? So folks that can shop for flights online at Expedia can now have the same experience on personal health insurance. And so we have, for the first time, premium data for each of the health plans that reference this. Again, voluntarily contributed in the sense that they didn't have to, there was no penalty for noncompliance. But because we saw data as an asset, we introduced 2 additional provisions. One, we asked the health plan, what percentage of the time did you deny access to this plan by somebody who applied for it? New data that had never been collected at the plan level before. And second, how often did you charge a premium over the base price that's listed? Because after the patient had gone through, the candidate had gone through the enrollment process, maybe they had a certain condition that required them to have a higher premium. What percentage of the time did your premium go up? And it's powerful. You can see in this, you can't really read all the detail, but the United Healthcare plan is cheaper at $980 for premiums, and only 10% of the time did a patient receive a surcharge. Compare that to the name I obfuscated for purposes of this discussion. Premiums starting at around $1,068, and 46% of the people actually paid more than that price. Again, the power of data in advancing our policy objectives. Next slide. It's a philosophy we used in our technology endeavors to liberate information, but to do so as part of a larger mosaic of policy levers to choose a role, the role of government as convener to advance our objectives. So opening data, one of 3 policy levers we've been focused on. The other 2 is engaging in that spirit of collaboration the President called for in the memorandum, especially in research and development, and engaging in voluntary industry-organized consensus activities. A word on each, and then boom, on to my 5 questions. Next. On pre-competitive R&D collaboration, who would have thought DARPA would lead the way in collaboration in new and creative ways with the program they launched last year called the Transformative Apps Program. The notion that there should be an open and competitive marketplace, provided there's sort of a common platform layer underneath, that would allow for not one, but hundreds of Pashtun to English translators, so that our warfighters can find the best app that meets their needs, and the market conditions, so the conditions of the market would render who benefits and who doesn't. So Transformative Apps is this radically creative notion by creating an open platform, allowing private companies to compete on value on that platform to serve the needs of our warfighter. Same example, next slide, in open data. Who would have thought we could create a secondary market for innovation? The federal government includes some monies in research and development, specifically in the area of education. And as you know, in the Recovery Act, the President put about $650 million on this very important challenge. But as you knew going in, the supply of ideas would far exceed our demand or our ability to buy them. We had 1,700 people apply for only 49 slots. So we created a secondary market because of open data. By agreeing in advance that we would publish all applications that scored over the peer-reviewed level of 80, whatever 80 meant, which was a high-quality score, north of 250 applications out of the 1,700 were designated as being in that high-quality category, having been peer-reviewed. Even though they didn't get funding out of the federal government, they had the ability to create that secondary market for philanthropists and others with the resources to put money behind those ideas. We saw an early version of this. Even the 49 that had been approved, they too had to come up with a 20% match. And because of the spirit of open collaboration, the philanthropy community actually organized a common portal that would allow anybody one-click access to those to their funds. And wouldn't you know it, in the 30 days following us provisionally awarding those 49 awardees, they were able to raise $55 million from philanthropy, or 40% of the total amount of the money they had to raise, because they were able to connect more seamlessly with these foundations. And by the way, many of them anecdotally said they ended up funding projects that they had never heard of before. Third policy principle on standards. I'm a healthcare guy by background, so if I go to the next slide, share with you the results of our collaboration that we launched in March of 2010. Following some testimony at a public hearing, a physician challenged us and said, "Why can't I safely and securely email my patient's medical data to another doctor? We email each other all day and night for everything else we do in life, but not healthcare data because of concerns that we would violate HIPAA." We put the task to these entrepreneurs and innovators in the private sector and convened consensus recommendations for specifications. In 90 days, they were successful in producing those specifications on SMTP. 90 days after that, they all agreed on a common reference implementation, so folks could basically make that spec real. And within 90 days after that, that is 9 months from the date we started, the first commercial transaction took place on the direct specification. Literally, a hospital in Minnesota, using a company that had no Washington lobbyist or insider, but just found out about this through the open collaboration, was able to safely and securely email immunization data to the State Health Department of Minnesota. Today, a year after the protocol was called for, over 50 organizations have announced that they will commercialize that specification. Going price, unlimited safe, secure email for doctors, $15 a month. And in today's competitive market, you watch that price go down. So this is the spirit by which we've tackled the notion of openness and applying it to our mission objectives. But why are we here? I hope we're here to answer 5 key questions. Question number 1. Big data. Big data. One of the most powerful aspects of our open government movement has been the fact that our federal data holders actually have large volumes of information. Translating that information into insight is something that will require more research, more thought, more creativity, and entrepreneurship. I'm extraordinarily pleased that there's been a growth